Generally, if the patient is having Cushing syndrome, generally it is increased by at least 4 times. Right? So whatever is the normal value, at least 4 times is higher in case of the Cushing syndrome. So if somebody asks you which is the best initial test to diagnose, what is your answer? 24-hour, increased 24-hour urinary free cortisol. Okay, now let's go further. If this is not given in the option, then the second best one for you is going to be the 24-hour, or let's not call it 24-hour, let's give the simple name, dexamethasone suppression test. But never forget, this dexamethasone suppression test is going to be the low dose. Low dose means we are only going to use 1 to 2 milligram of dexamethasone. Low dose. So if they ask you what is the best initial test for diagnosis of the Cushing syndrome, what is your answer? 24-hour calculation of urinary cortisol. If this is not in the option, then what is your answer? Low dose dexamethasone suppression test. And by the name it's very clear. We are going to give the patient dexamethasone. Right? How many mg? 1 to 2 mg, low dose. And then we are going to see whether the cortisol is becoming less or not, whether it is being suppressed or not. So in this case, we simply say that it is the low dose dexamethasone suppression test. But now the new method is also being very common these days, and this is called as midnight blood or salivary, especially the children. The very commonly being used these days is this one. In the midnight, the saliva is tested for the cortisol. So midnight, either we can test the blood or we can even test which one? Saliva for the cortisol. And if they are high, then we can say that maybe patient is having the Cushing syndrome. Especially the salivary cortisol level is very commonly being used in case of the children. Never forget that. Right? And slowly it is so easy to perform that slowly it is being more famous. Maybe in the future this will become the first one. Right? So why I am describing these 3 things together here, the reason is very simple. Many students, they always know this particular test, low dose dexamethasone suppression test, right? And the exam, when the question is given, which of the following is the best initial management, the student have this tendency always to choose which one? Low dose dexamethasone suppression test, because it is more famous in the exam. But if in the option they have given increased 24-hour urinary cortisol, then the best answer is this one, right? If this is not given in this option, then only it is going to be low dose dexamethasone test. By the way, why we are calling it low dose dexamethasone test? Because we are giving how much amount of the dexamethasone? 1 milligram. But later on, I will teach you another test. We call it high dose dexamethasone test. And in this case, we give 8 milligram, 8 times more. So we have got low dose dexamethasone suppression test, and we have got the high dose dexamethasone suppression test. Never forget, low dose means how many milligrams? 1 to 2. And high dose means how many milligram? 8 milligrams. One more thing here I must tell you. Why we prefer the 24-hour urinary cortisol? Why we don't prefer the low dose? Because this test have the chance to give lots of false positive. Right? The low dose dexamethasone can give you false positive, and there are 3 situations that we must not forget in which it can give the false positive test. One very important one, if the person is very obese, and he is not having the Cushing syndrome. When he will test the cortisol, maybe he will find that if you do this test, low dose dexamethasone suppression test, maybe you will find that he is also having the Cushing syndrome. So we call it false positive result. The another one, very common one that you should not forget is if somebody is taking alcoholic. So in the alcoholics also we find that the patient can have the low dose dexamethasone suppression test to be positive. Clear what this thing? And then another one, which is the one that we are very much caring about, the depression. If somebody is in the depression and if you do this low dose dexamethasone suppression test, we are always going to find that it is going to be positive, but this positive is going to be false positive. So my question to you, out of these 3 initial tests, which one is the best one? 24-hour urinary free cortisol level, right? If it is increased, and generally in the Cushing syndrome it increases by how many times? 4 times. Then the patient is going to have the diagnosis of the Cushing syndrome. But now, only diagnosing the Cushing syndrome is not enough. We must know how to find out the different localization, how to find out whether it is the Cushing disease, whether it is the adrenal adenoma, or it is the some paraneoplastic feature causing the situation. Finding the exogenous is very simple. If somebody is taking the drug, then we can think about exogenous. If somebody is not having any drug history, then we are not going to think about the exogenous, right? So now I will tell you the method of finding the exact cause of the Cushing syndrome. So all of us, let's try to understand this thing. So I'm giving you one algorithm that how exactly can we use this algorithm to go for a patient of Cushing syndrome. So suppose a patient came to you and you had the suspicion about the Cushing syndrome. By the way, what things will give the suspicion? Give me the common sign and symptoms. What is the first manifestation? Fat redistribution. Tell me the three things. Moon face, buffalo hump, truncal obesity with purple stripe. Tell me the second manifestation. Hypertension. Third one. Hirsutism, amenorrhea, and in the male, erectile dysfunction. Tell me the fourth one. Hyperglycemia. Next one. The patient is more having risk to the fracture and the osteoporosis. Tell me the next one. Immunosuppression. Right. Next one. The skin is going to be very thin. It is going to be easily bruisable, and it is also going to have the chance of decreased wound healing ability. Isn't it? So in this way we learned some things, and then we learned the lab values. What are the lab values found in the Cushing syndrome? Tell me. The glucose will be increased, sodium high, hypernatremia, potassium, hypokalemia, the LDL increased, right? And hyperlipidemia it means, and there will be WBC will be increased. Tell me the cause of the leukocytosis in this case. Marginalization, right? So there is going to be demarginalization. Okay, so now all of us focus here. Suppose this patient have these features. So now you suspected that maybe the patient is having Cushing syndrome. So as soon as you did the suspicion, what is your first job? Which test are you going to do? Which is the best test to diagnose the Cushing syndrome? Tell me. 24-hour urinary. You can do the 24-hour urinary. At the same time, let's do one thing. I'm not going to put in the center. Let's do one thing. For the diagnosis, the best test is the 24-hour urinary. Cortisol level. Right. And think about this. If it is not increased, right? If it is not increased, it means the patient is having Cushing syndrome or no Cushing syndrome? No Cushing syndrome, so you are simply going to rule out the Cushing syndrome. Right, you are going to rule out the Cushing syndrome. Very easily you can rule out the Cushing syndrome. If it is not increased 4 times, generally 4 times, but you can rule out the Cushing syndrome. But if you found that the 24-hour urinary cortisol is increased, right, it is high, very high, more than 4 times generally, then you are going to have the diagnosis of what? Cushing syndrome. So this is for the diagnosis. Till now there is no problem for this one. So we have already diagnosed the patient is having Cushing syndrome, but we don't know what is the cause right till now. But just now I told you that there is not only one method to diagnose the Cushing syndrome. One of the method is 24-hour urinary cortisol, and what is the second one we discussed just now? The low dose or high dose. So we call it 24-hour low dose dexamethasone suppressed. By the way, low dose means how many milligrams? It is going to be 1 milligram, 1 to 2 milligram. So suppose that we have given the 1 milligram for this patient, and we gave the dexamethasone to this patient, and you found the cortisol decreased. You gave the dexamethasone and you found the cortisol got suppressed, it decreased. Right? It means the patient is having normal physiology or abnormality? Normal physiology. Whenever we give extra dexamethasone, the cortisol should be decreased with a negative feedback. So you found that the patient, the cortisol decreased, or let's not say decreased, let's say cortisol got suppressed. Cortisol suppressed. It means, is it the Cushing syndrome? No. So we have simply ruled out the Cushing syndrome. We have ruled out the Cushing syndrome. But say that we gave him the low dose dexamethasone suppression test, but we found the cortisol was not suppressed, cortisol was still high, not suppressed. Cortisol did not get down. It means the giving dexamethasone is not causing the negative feedback to this person, means that there is something which is causing the high amount of cortisol in the body. right? So again, we can simply diagnose which disease? Cushing syndrome, right? So we have got the two methods. In fact, we have got three methods, but right now I'm discussing about only two things. So even, why only two things? You can even put the third thing here. Suppose that you did the midnight, which testing? Midnight, salivary or blood cortisol, and if it is high, then we can think about which disease? Cushing syndrome. If it is normal or low, then we rule out the Cushing syndrome. So here you can say, to diagnose this Cushing syndrome, we have got three different methods. We can use this one, or this one, but which one is the best method? 24-hour urinary. And tell me the three causes of the false positive in case of the low dose dexamethasone suppression test. Obesity, alcoholism, and which one? Depression, right? Okay, now let's say that patient got the Cushing syndrome.